All right, good evening, everybody, and welcome to the Lee School Committee meeting. It is Thursday, August 12th at 5:30. We are in a virtual meeting room per Governor Baker's order suspending certain provisions of the Open Meeting Law GLC 30, Section 20. This meeting will take place virtually via Zoom. Pursuant to MGL 30C, MGL C30A Section 20, I'm hereby informing all attendees that a video and audio recording is being made of the meeting. Brenda, could you do a roll call, please?
Mr. Robin?
Here.
Mr. Kinnis?
Here.
Mrs. Kushert?
Here.
Ms. Larman?
Here.
Mr. Nichols?
Here.
Okay. Ms. Strickler? And Mrs. Wadsworth?
Here.
Before we get to public input, I wanted to thank everybody that took the time to send us all an email, and also thank everybody that took the time to fill out the survey that Superintendent Richard sent out today. And I also wanted to let everybody know that everyone on the school committee has had a copy of the results of the survey, which included all of the comments that you input into the survey, and we've all had a chance to read all of the comments. So if you put something into the comment section, you don't necessarily need to repeat it during public input because we have all had a chance to read them. And I would also like to remind anybody that is going to say anything during public input that we do have a 3-minute time limit during public input. So we'd like to ask that you adhere to that. And with that being said, if anybody would like to say anything during public input, I would welcome it now.
Hello. Good afternoon. I don't know if you can hear me.
Yes, Stephen McQuade, is that correct?
Yes.
Yes.
We did send an email out as a family today. I know we got a couple responses from a couple of you that saw the email, but I wasn't sure if everybody had a chance. So I just figured I would mention a couple points that we brought up in our email. Our son is actually starting at Lee Elementary School this year via school choice. We actually just moved to the area. We picked Lee Elementary School for school choice because it came very highly recommended to us in the area for its programs and acceptance for students with disabilities. So, you know, my son does have a severe medical condition. It is a terminal diagnosis. He did spend the last year as a remote student, which was very tough for him. You know, he ended up pretty behind. We definitely did our best, but you know, it's pretty hard to, you know, for especially a student with disabilities that needs accommodations to school remotely. So we'd really like to be able to send him back to school, you know, this year. Our biggest fear being that, you know, a lack of mask mandates for somebody like him who's already immunocompromised, already has a medical condition, poses a huge risk. You know, for a little kid like him, he's only 9, so we can't vaccinate him just yet. You know, we obviously are waiting with bated breath for, you know, October when they're supposed to be approving it, and, you know, we'll be first in line. You know, he's enrolled with palliative care, hospice out of Lee, so, you know, they're going to get him on the list immediately. But, you know, we definitely like to see, hopefully, you know, going forward, at least some sort of mask mandate, you know, in place for, you know, the beginning of the school year, especially before there's vaccinations, you know, just to protect, you know, him and kids like him, especially, you know, kids that can't be vaccinated yet. and those who are at, a very high risk compared to others. Because we really don't want to be put into a position where we have to make the decision to keep him home again. Just because we do have to take extraordinary precautions to keep him safe. And I know there's a lot of friends that we have within the palliative care group that, at least feel fairly similar. I sent a pretty detailed email to all the counselors, I believe. But, I just wanted to reiterate a couple of those points for anybody that might not have been able to read it just yet. Thank you.
Thank you, Stephen. Mike, is there anybody in the,
It looks like Brandon Boulais has got his video on and looks like he unmuted, so I think he'd like to offer comment.
okay, Brandon.
Cool. Thank you, Mr. Richard. Being a teacher, going back into the schools, I'm vaccinated. I plan on wearing a mask. I plan on wearing a face shield. I just worry for those faculty that I just don't want anyone at risk, and I want to be as safe as possible. And I know last school year was a challenge, but we kept social distancing. I sanitized my art supplies in between every class, so no two students were touching the same art supply. And I believe that has changed. So students will be sharing supplies, students will be sitting closer together. I really feel like starting the school year off by having a mandated mask is just an effort to keep people safe, both faculty and staff. And so I strongly encourage the school committee to take that into consideration, that, it's not about infringing on anyone's rights. It's about just keeping people safe. And at least in this regard, wearing masks is a step in the right direction of keeping people safe. All right, thank you.
Thanks, Brandon. Anybody else, Mike?
No.
Oh, Courtney Sparks.
Hi, can you hear me?
Oh, yes.
Yeah.
Sorry, I'm on my phone, so I can't figure this out. I just want to thank you all for what you're doing. I know it's a tough decision, and I want to thank Andrea Wadsworth for responding to my email and putting the survey out to everyone. I really appreciate that input. And I'm just wondering if you're going to tell us what the results were. That's all.
I'm looking to Andrea Larman to see if you want, I don't know if you want me
That's fine,
to.
Mike. I didn't know if you had the final tally in front of you.
I do. I do. So I can tell you that there were 363 respondents to the survey. And I know when I sent numbers to the school committee at 4:30, I think that there were 350. So there were some additional responses since 4:30 when I sent the last iteration of the survey results to the committee. Of those, I can tell you that, well, you want me to share the screen? Would that be easier for everybody? I'm happy to do that. That's probably, I
Yes,
apologize.
please.
So here are the responses.
Can you increase it a little bit?
I think that I can. How's that?
Perfect.
Okay.
So again, 363 responses. I'll give each of these slides, I don't know, 10, 15 seconds for people to process. you can see from this slide that about
Mhm.
almost 3/4 of the responses were from family members.
This one.
And this is the sort of the aggregate results there. There were, if you can see at the bottom, there were 132 respondents who shared some written feedback. And all of that feedback was passed along to the committee, although maybe minus a half dozen or so that came in after 4:30. So there are a few. I have not had a chance to look at those since 4:30, so I'm not sure what they say. But there were, I think when I passed it on to you at 4:30, 125 written responses.
Thanks, Mike.
You're welcome.
Is there anybody else that wanted to speak during public input?
Hello? Can you hear me? Hang on one second. Sorry, I'm having a problem here.
Oh, Mr. Desantis, we can hear you.
Yeah. I just wanted to talk real quick. The way I look at it is I was hoping that the parents would have the right to decide whether or not their child wears a mask. I don't want to get down into the weeds as to why. You know, there's lots of studies out there that say that masks are not effective at preventing the spread of COVID. But that being said, other people believe that they are. My point is that I think it should, or myself and my wife think that it should be the parents' choice to decide whether or not they wear a mask. Every kid's different. I have 2 kids in the district. My children, when they have to wear masks all day, they come home with frequent complaints of headaches. My daughter has allergy polyps in her nose that's developed. And there's other issues. I don't know if there's, maybe I'd be willing to sign a release if I needed to. I don't know how other parents feel. If liability is what the district is worried about. But yeah, I mean, I think it should be the parents' choice. That's all I got to say. Thank you.
Thank you.
Hi, I know I'm on the same account, but I'm Danielle Boulay. My husband is a teacher. My son attends Lee Elementary. We kept our son home last year because we live with somebody who's immunocompromised. So we were very concerned about him catching anything and bringing it home. Obviously, my husband's a teacher, so he needed to return to work. So he masked, he wore a face shield every day in order to keep everybody safe. Unfortunately, with the new variant, masking is preventing people who are vaccinated from carrying this to other people. I'm concerned that if there's people who aren't masked, even if they are vaccinated, they could be giving this to my child, to my husband, to bring home to somebody who is still immunocompromised. Now, we're vaccinated. My son, unfortunately, is too young to be able to be vaccinated at this point. So my major concern is bringing something home, and kind of according to some of the data that's coming out, and I completely agree, you read one thing, then something else contradicts it. More children appear to be getting this because it is more contagious. So the concern would be if there's not masks, that it's going to be spreading through the schools and coming home. Some children are getting very ill. Some are just getting lighter symptoms. So, I'm definitely for everyone, regardless of vaccination status, having to mask until at least things improve. I mean, Berkshire County is in the red right now. So we are at a high transmission rate right now, and maybe it needs to be based on that kind of data where we did last year, where it was kind of looking at what was going on specifically. But right now, we're one of the counties in the state that has a higher transmission rate. So, thank you.
Thank you. Angela.
Hi, I'm a parent of what will be 2 LES students coming in the fall. And I just want to commend like how well things went last year. And I think it's because the school committee put in the right regulations and guidance to keep all the students safe and keep them in school where they needed to be. And so we are very supportive of still having the students and staff masked for the exact same reasons. Like, you know, the data overwhelmingly supports that this is like a really positive measure. Yes, it sucks, like no one enjoys it, but I think the benefit of having them in school far outweighs the, the issues that might be caused by masking, and no one enjoys it. But I think the more we can, the more they can maybe focus on outside activities that give them more mask breaks, so they're not, inside in masks all the time. I think I'm super supportive of that. But anything that kind of can maximize the safety of the students and the staff, as well as like keeping them in person, I still think is the right way to go.
Thank you, Angela. Pat Feldman.
Hi. I've been reading study after study, and I'm just concerned about the close to 3,000 children within the age groups that we teach on a daily basis that have tested positive in the past 2 weeks in Massachusetts. I feel like we really need to think about their safety and the safety of those that they live with or encounter. I don't know, for what it's worth, I just want us to keep everybody safe. Thanks.
Thanks, Pat. Does anybody else want to share? Well, I don't see any other hand raises, so I am going to move on to the policy that was developed by the policy subcommittee during our policy subcommittee meeting at 5 o'clock. So I will read through the policy as the policy subcommittee chair. So the file is EBCFA, face masks. The Lee Public School District is committed to providing a safe environment in schools during the ongoing, during the ongoing COVID-19 pandemic. Maintaining a safe environment is critical to the district's ability to returning students and staff to a full-time classroom learning experience. According to the public health experts, one of the best ways to stop the spread of coronavirus and to keep members of our school community safe is the use of face masks. Therefore, using the guidance and recommendations from the Center for Disease Control, CDC, the Department of Elementary and Secondary Education, DESE, and the Massachusetts Department of Public Health, DPH, the district has established the following requirements, which will remain in place until further notice. A face mask that covers the nose and mouth must be worn by all individuals in school buildings and on school transportation. Individuals may be excused from the requirement for the following list of reasons per CDC guidance. The individual has trouble breathing, is unconscious, is incapacitated, cannot remove the mask or face covering without assistance. In addition, masks will not be required for anyone who has a medical, behavioral, or other challenge making it unsafe to wear a face mask. A written note from a physician is required for a requested exemption. Parents may not excuse their child from face mask requirement by signing a waiver. Additionally, face masks will not be required when appropriate social distancing is enforced. During mask breaks, while eating or drinking, during physical education classes while outside. Exceptions to this policy under certain circumstances, such as for students with medical, behavioral, or other challenges who are unable to wear masks, must be approved by the building principal in consultation with the school nurse or local board of health. Face shields or physical barriers may provide an alternative in some instances. A student's mask is to be provided by the student's family. Staff members are responsible for providing their own mask. However, the district will supply disposable face coverings for individuals who arrive at a building or board school transportation without one. If students are in violation of this policy, the building principal will consult with the parent guardians to determine whether an exception is appropriate or such student may be removed from the building for in-person learning until such time as they comply with the requirement or the requirement is lifted. Violations of this policy by staff will be handled in the same manner as other violations of school committee policy. Visitors in violation of this policy will be denied entry to the school district facility. For the purposes of this policy, neck gaiters and bandanas do not constitute a face mask. This policy will remain in place until rescinded by the school committee. And the guidance was from the Mass Department of Public Health, the Centers for Disease Control and Prevention from August 5th, 2021, and the Centers for Disease Control for Prevention for Public Transportation, and the Department of Elementary and Secondary Education Fall 2021 COVID-19 guidance. And the source was MASC August 10th, 2021. Yes, Andrea.
So for the purpose of discussion, I make a motion that we move this policy forward as written.
Do we have a second?
I'll second.
Any discussion?
So Andrea, I'd just like to add two, if we could just qualify two things.
Yes.
that come up. When it lists the authorities, could we add also our local health department? Because sometimes, you know, it goes CDC, state, and then local, and local wasn't referenced. So I think that would be good. And could we just also delineate between, I know we have gym class, and that was explained in the subcommittee meeting. That was great. What happens to, and sports are outside, but what happens to sports that are inside? So a sport that might be inside that is a game, is that, do they wear masks or not?
I believe that, does that fall under the MIAA regulation stuff?
I don't know. I'm only on wrestling for MIAA. I don't know.
I don't
know other sports.
I don't know.
It just seems like it would, because we're saying inside the building.
If it's inside the building, they would have to wear a mask, but I would assume that there's going to be, isn't there regulations through MIAA?
I don't know. Maybe Greg can help us.
I don't know. Is Greg here? Greg, are you here somewhere?
I am.
Yay.
So there's two things on this. Thank you, Andrea. There's two kind of separate issues on there. The MIAA will be making, I assume at some point in time, recommendations on a per sport basis about masks. If they do not, last year's recommendations at this point in time have expired, so masks are optional. However, the way I read this policy and knowing the MIAA makes rules, but local school committees can go further. My read of this policy as it exists right now is you've carved out an exception for PE classes during socially distanced activities. But there is no, by my read of the policy, there is no exception for indoor sports, because sports and PE are two very different things. So as written, my read of this policy would be that participants would have to wear masks for practices and games for indoor sporting events.
Hey, Greg, what sports in the fall are indoors?
Volleyball would be the only fall sport that's indoors. In the winter, obviously basketball, And we don't have any indoor sports in the spring, although all of them start indoors practicing in the spring.
And we haven't had anything from MIAA to say whether they're going to require masks for games.
There's been nothing at this point about masking guidance from the MIAA for this
Are they-
coming school year.
Are they waiting for schools? I bet.
If I were to hazard a guess, yes, they're
I bet
they're letting individual schools make those calls at this point in time.
And how is our local Board of Health weighing in on this masks versus no masks?
They say masks.
Okay. Or are they requiring it or recommending?
May I, Andrea?
Yes.
I forwarded an email that I received unsolicited today from Dr. Westpizer, who's a school physician, sits on the Board of Health. He sent me an email and asked me to forward it on to anybody that I thought appropriate. So I sent it along to you guys. He is recommending mask wearing. And I would suggest that based on a meeting with Jim Willis on Tuesday from Tri-Town, he's also recommending mask wearing.
From my understanding, the local Board of Health can supersede any state guidance, any federal guidance. In Massachusetts, they're allowed to make a decision on this. And so they haven't made a decision other than a recommendation, is what I'm hearing.
I don't know the answer to that question, Mr. Kennis, but what I know is I haven't been directed, if you would, by anyone at this point, perhaps yet, maybe the school committee in a few minutes, but by anyone around whether masks need to be worn in schools. There was a memorandum that was sent from the town administrator that masks are required in town municipal buildings for staff, excuse me, and visitors.
Would that count as our schools, though? The schools being a town building?
I think that the school is sort of technically a town building, but we're as I was advised that we weren't subject to that memorandum.
Thank you.
Yeah, so my point, all the pressure right now is on the school committee to make a decision one way or the other, with all these outside professional sources kind of just making a recommendation and not making it required.
Yes. Oh, sorry, Andrea. I didn't realize you had your hand raised. I thought you were still up from before.
No, I would take it down. I'm just trying to follow the virtual like protocol, I think. Can I go back to the sports thing? Because someone did ask me this, so they can, as it sounds now in our gym class, is different than sports, but if they follow that, could they not wear a mask and socially distance? And how do you play if you socially distance?
For sports?
Yeah. I just think it's fair that we probably like discuss this so the administration has, unless Greg is crystal clear that there's masks while sports are in the building being played. I don't know. Greg, are you saying you're clear and you're fine with the way it is, or would you like more clarification?
All I'm saying is that by my read of the policy, that's as it's worded right now, that is the situation that we have, which is sports practices and games that are indoors, they would be required to wear masks. And I would say that the committee, if they're good with that, that's great. You can leave the policy the way it's worded. If that's not the intention, because I know we had that carve out for PE class, but PE and sports are two different things, as I said. So I think that, if the committee's, if that's your intention, that's great. You don't have to change anything. I just think it's important to be clear because, for example, volleyball does start up in about a week.
I think my concern is that it's harder to socially distance in sports than it is in PE. And if we're expecting kids to be masked, if we don't expect kids to be masked during sports, And it sort of wastes, it sort of null and voids the point of having them masked in school.
Thank you.
So I'm interpreting.
I
interpret it the way Greg interprets it. So sorry, go ahead, Kirk.
no, sorry, you know, I definitely echo. My first grader has to wear a mask to go involved in sports, and they're exempt from masks. I kind of do take issue with that. If you know, if they're going to be inside, indoors, can't socially distance, if they're going to be in close contact with each other, and we're going to require students in a classroom to wear a mask, I do have I have a problem with that, and so that's my opinion.
A problem with which? Sorry, you were skipping in and out, Kirk.
Sorry, I have poor cell service out here. If we're going to require our students to wear masks in the classroom, then I think that we need to be you know, pretty firm about requiring our students that are involved in sports, if they cannot 100% socially distance, if they cannot, you know, if they're going to be in close contact with each other, they're going to be indoors, and the sports need to follow the same, I feel,
Right.
the same regulations that our children are being forced to follow.
Right. So it sounds like you're reading it the same way as well.
I believe so.
Yeah. Okay. Any other discussion among the board?
And so if we go forward, we vote to approve this policy, then we're going to be in mask. Is that correct?
Correct.
Okay. You know, if I just have a minute, I have been kind of removed from the world for the last week or so, but I have taken some time to check in, and I've gotten some emails, and I've checked in a bunch today with the superintendent's checkups with the survey that was put out, and a lot of the comments that parents and families and guardians submitted, and this is a very, very tough decision. I kind of echo what Randy said, how this is difficult, that there are all these outside agencies that are recommending strongly that we do something, or they're saying that we should be doing something, or, you know, they're recommending that we do these things without telling us or mandating that we have to, and it's putting the decision based on us, or the decision to mask or not on our shoulders. And I really feel, that parents should have the right to choose whether or not they send their kids to school in a mask. I also feel for the parents and families who have, you know, situations in their life that they need their kids to be masked. So I am of the opinion that parents should choose whether or not they send their kids to school in a mask. That's my comment.
Okay.
You know, and Kirk, I'll say too, I felt the same way. And I'll make an analogy here. So, you know, the peanut allergy, right? When there's a kid in the classroom that has a peanut allergy, your kids can't bring peanut butter products into the classroom because we want the safety of that one kid. After listening to Mr. McQuade today, I feel that was a really powerful example of how we can do a little thing by putting masks on to save someone's life. So in my opinion, I think the mask mandate should go forward as written, but also I'd like to see some metrics within that. You know, the positivity rate is right now at what for Berkshire County? If it gets below a certain benchmark that we feel is acceptable as a school committee, if we're still in this decision process, you know, 3 weeks, 4 weeks, 5 weeks down the road, then we should set that benchmark. and figure out, and then so we can go back to no, unmasking, parent choice type of thing. So if that's something that could be written in, I would strongly encourage that.
I definitely, sorry, Andrew, go ahead.
I was gonna say, I think the committee can come back at any time and make a decision to rescind the policy.
And I agree with that.
There doesn't have to be a metric written in. It doesn't.
Maybe not, yeah, all right, but as long as there's an understanding that there's a benchmark that we can talk about as, let's just use 1% for an example.
Yeah.
If it's over 1% right now, we're gonna adopt this mask mandate. But under 1%, is that the benchmark that we say we can come back the next week and say, you know what, it's parents' choice? I think that's a good compromise.
Andrea Wadsworth.
So there are benchmarks already set by local health department, CDC. We could adopt those. And then maybe every meeting or every 2 weeks, the superintendent sends us a report. And if, the metric is within a range that we set, almost mirroring the color range that we have in the county, we could have a report, and then we could deem a meeting within 48 hours to review that. And so that's the way, so there's a policy and then there's a process. They're two separate things. And maybe that's a good process for us.
I would support that.
Okay.
I would support that as well. I definitely, I read Mr. McQuade's email and he spoke tonight too. And I do feel for him and his family, like I said before. It's tough, when you look at the results of what parents and what our families want. 52% say that they want masks. 47.9% say that they want to follow DESI guidelines. Or parents' choice, or however you want to put it. I don't want to see us, blasting into masks for the rest of the school year. I definitely think that we should, as a committee, really follow it closely and make sure that we're making appropriate moves based on the data that's available for our region.
Right.
And I would definitely support that 100%. I'm not against masks by any means. I struggle too, because you look at it and do you want to be the committee that makes a decision and then the disease is transmitted and then it ultimately takes someone's life? Where does that fall? Does that fall on us? Does it fall on who knows? So it's a tough decision to make, but it has to be made.
Agreed. Yes, Aaron.
Yeah, for me to talk is very rare sometimes, but again, I'm going to speak my piece, and a lot of it is the way the policy is written. I think a lot of it is my thinking. All right, is safety. I understand the safety for everybody in the school, the teachers, and those when the kids come home, make sure that nothing gets committed. That doesn't happen. But also I understand that this is not set in stone either, where we can take a look every so often on where we are to decide whether or not, okay, this is the time to do it. And again, this is a very hard decision, just like last year was even a lot harder decision, which direction to go to school on. It's not an easy thing. And even today, looking over all the emails, looking at the charts, looking at the subcommittee thing, again, going in there as three different perspectives: my profession, as a parent, and as a school board member. And as a parent, I would want my kid to be safe. And as a parent, I would want my kid confidently know that my kid's going to school safe. He's safe. I don't have to worry about it, because I really don't hate to say it, get a phone call. I'm about 40 minutes away to come get my kid or whatever it is. And the whole idea is that, again, I see it as safety. Yes, I understand the other issues about parents' right to make that decision. I understand that too. But when it comes down to everyone in the same place, until we get to go ahead or we relook at the numbers again, where we're at, masks may need to go. Start off the year with. Then we can always, time goes on, look at it, which I agree with too. And, it's almost like today, it was just all day, very hard to figure out which way to go. And I know wearing a mask is tough, 6.5 hours. With my asthma, it's not easy, but I can understand the parents with the medical and all that stuff too. But it is hard. And safety, I think, is always been priority in a way.
Thanks, Aaron.
You're welcome.
And if I could just echo that, I just wanted to say, first of all, I thought Andrea Wadsworth, it was a great idea about the survey. Mike, it was awesome how quick you got it out and gave us the results. And then to all of the parents, everyone watching, I want you to know that I feel like we all took it very seriously. And I read and reread, and I can promise you, I read each and every comment 3 times to really make sure I was taking it all in. And I know we've all said it's a very hard choice that we don't want to have. I will say it's a hard spot to be in, but it's not that difficult for me to make the choice, because I think that right now it sounds like what we are all saying, and where we're at, where we agree, is that right now with the data that we have, and this policy looks like it fits, and the kids have to be masked. I mean, there's no, I think mostly from the committee, that's what we're hearing right now, that where we're at right now in the red, we have to keep our staff and students and community going even further safe. I mean, I think that we have to.
Thanks, Nicole. Okay. Any further discussion? Andrea Wadsworth.
I'd like to amend my motion to include the local health department and also to include a waive of the second reading. So if everyone's not, I don't know if everyone's familiar with that. We read policies twice. So it was read once tonight by Andrea, and then we wait a whole nother meeting to read it again. I don't know that we have that luxury. So I would like to amend my motion to include excluding the second reading, waiving it. So I need a second.
Do we have a second?
I second.
Any further discussion?
I just don't want to lose the metric piece of it and the benchmark piece of it too. And I don't know if it needs to be written in, or we just.
It doesn't need to be part of the
motion. We can add another motion to direct the superintendent to come up with a metric that we can review and vote on, and then we'll institute that.
Yeah.
Let's do that, Andrea.
So that's not part of this. That's not part of the policy. That'll be.
I'll make a second motion after you guys vote on this motion.
We vote on this. Yes. Okay. So any further discussion on this motion for the policy? Okay, Brenda, can we have a roll call, please?
I have a question. Andrew, your motion was your amended motion is to include local health officials?
Health department.
Oh, health department. Okay. Thank you. And where will that be put in?
Probably after Mass DHB.
Yeah.
So it goes CDC, Mass Health Department, and local health department. You could say Tri-Town.
Tri-Town, yeah, that's it. Tri-Town. Yep.
Yep.
Okay.
Michael put it in.
Okay. All right, Mr. Robin. Can everybody hear me?
Yep.
Okay, Mr. Robin?
Yes.
Mr. Kinnis?
Yes.
Mrs. Kushurik?
Yes.
Ms. Larman?
Yes.
Mr. Nichols?
Yes.
And Mrs. Wadsworth?
Yes. So
now you can.
Okay, the motion carried, Andrea.
Yes.
Okay, so now I'd like to make a motion that we create a metric based on the CDC guidelines and local health department guidelines to be reviewed at least monthly, if not sooner, when deemed appropriate by the superintendent.
Do we have a second?
I'll second it.
Any discussion? Brenda, can you do another roll call, please?
Mr. Robin?
Yes.
Mr. Kenneth,
Yes.
Mrs. Kusher,
Yes.
Ms. Larman,
Yes.
Mr. Nichols,
Yes.
and Mrs. Wadsworth.
Yes.
Okay. The next thing on our agenda is the LES and LMHS school year 21-22 handbook update approval. So on Tuesday night, Mr. Briganti and Mr. Mertnuck presented some changes to the handbook, which needed to also include the mask policy that we just spoke about. And I know that one of the other things that we were going to discuss was the hand washing component to both parts. Yes? Was that the only thing that was on the table? I'm going to put it to you, Andrea Wadsworth, because you had the question about the handbook, correct?
Yeah, I mean, I kind of love the hand washing, but if Greg and Tim say it's already in there somewhere, it's just not in front, I'm okay with that.
Okay. So
I
it's
think
just
hand
that,
washing is like first line of defense of COVID-19 too.
okay.
So as they can confirm it somewhere else, I'm okay with it being taken out of the front.
I can confirm that it can be in the main body of the handbook, not just on that front page. And
Okay.
I think I speak for Tim as well on that.
Tim's here.
Oh, he is.
Interview, thanks. I agree with Greg 100%. Hand washing will be in the handbook as well, for sure.
Okay. All
So
right.
I'll make a motion to accept the handbook of the Lee Elementary School as written and presented.
I'll second it.
Any discussion? Okay. Roll call, Brenda, please.
Mr. Robin,
Yes.
Mr. Kenneth,
Yes.
Mrs. Kusher,
Yes.
Ms. Larman,
Yes.
Mr. Nichols,
Yes.
Mrs. Wadsworth.
Yes.
Okay. And the last thing on our agenda is, oh, sorry, Andrea.
Someone's got to make a motion for Greg's. I only did the elementary school.
Oh, sorry.
Yeah.
I thought you did both, sorry. We need to take a motion for the LMHS handbook.
I mean, I can do it, but I don't want to take them all. I make a motion, we accept the Lee middle high school handbook as written and presented.
I'll second it.
Any discussion? Another roll call, please, Brenda.
Mr. Robin,
Yes.
Mr. Kenneth,
Yes.
Mrs. Kusher,
Yes.
Ms. Larman,
Yes.
Mr. Nichols,
Yes.
and Mrs. Wadsworth.
Yes.
Okay. And last thing on the agenda is adjournment. So I will, oh,
Actually,
what? Go ahead, Kirk.
I do. We talked about masking and COVID tonight, and I want to ask, because I saw on some of the pie graphs that the superintendent put out for us is that we have faculty and staff that is unvaccinated. Do we have a number, like a percentage number for that? It was pretty tight in there, and it was kind of hard to see. I feel that if our students and our families are making all these steps, and I know by virtue of my profession and my inability to work remotely, et cetera, I was right up there to get vaccinated when it was time for me to do my part. I am struggling with the fact that we have our students that are masking, that we're talking about this variant, we're talking about this pandemic. and we're making decisions for our kids to be safe at school, but we have faculty and staff in the school that apparently are not vaccinated. And so I'm kind of taking issue with the fact that we're doing all this on our end, and the people that we have employed by the school, or some people that are employed by the school, are not, I don't want to say pulling their fair weight, because I know everyone's making sacrifices. But if we're talking about doing every little thing that we possibly can in order to keep our kids safe and prevent the transmission of disease and prevent someone from having a terrible outcome, I think we need to address that as well, even if it's one faculty member. I think we need to address it. I know Berkshire Hills did the same thing. It's on, it's in the Eagle or it's on the paper or something, that they've required masks and they've required vaccinations for their faculty and staff. So I don't want to, I understand that there are people out there that have their strong opinions about a vaccine. I took it twice. I'm in good shape, but I want to bring this up to the committee to see what everyone thinks about, because here we are, we have a bunch of parents, emailing in, taking their time to take a survey, giving their opinion, one way or the other. And I'm just curious what the rest of the committee thinks and feels, because I think it's pretty appropriate to ask our faculty to be vaccinated if they're going to be around our children, especially our children that are under the age of 12 or whatever that number is, like my daughter, who cannot be vaccinated right now, and the kids that can't be vaccinated because they're immunocompromised, or they have underlying health conditions that prevent them from receiving a vaccine, or they just plain haven't been vaccinated yet because there's not one available. So I would like to ask what the rest of the committee thinks and feels about this. And if appropriate, I'll make a motion that we require our staff and faculty at the school to be vaccinated.
I think Andrea has a comment for you.
Let's hear it, Andrea.
Yeah. So I completely agree with you. I worry moving the needle on this variant and this pandemic is getting vaccinated. It's the reason why we don't have polio, but it's very political. And so when I saw Berkshire Hills did that the other night, I thought, wow, it was a bold move. I don't know if this committee's ready to make bold moves like that. There probably will be some pushback. There may be some arguments about choice, but there's a choice on where you go to work. So if that's mandated, that will be something that happens. I would suggest, if this becomes something that we consider, one, you could make the motion and you could put it on the floor right now. It's not on an agenda, so it would have to be deemed new business by the chair, unexpected within 48 hours. That might be a little thing. Or we make a motion to send it to the policy subcommittee. We get a draft policy and we meet in 2 days to discuss that policy they have. And I'm assuming there's other policies out there right now we could borrow and look at for that subcommittee to consider.
Appropriate. We definitely, for something as important as this, where if you've got an employee now who's not vaccinated, the chance of there being some pushback, I'm just going to, knowing people, is probably going to be pretty decent. So, I don't want to rush into it and throw it to a vote without even having a policy in front of us. So Andrea, I think that's a very decent idea, very good idea, that if we can allow our policy subcommittee to put something in front of the regular committee or the full committee, I would be very okay with that. I just wanted to bring this up. We're having this conversation about masks. We're having this conversation about the school's COVID response. I think it's just as important as putting masks on my 6-year-old when she comes to school in a couple weeks.
So I like this discussion. I like where it's going. And so I just asked Mr. Richard, do you have any sense of how many staff and faculty percentage wise that are vaccinated? Has there been any indication or any of survey done amongst the faculty and staff to indicate one way or the other?
So if I could answer that. So based on the survey that was conducted today, based on the results that we got today, 5 of the respondents from LMHS said they are not vaccinated, and two of the respondents from LES said they are not vaccinated. The last survey that was done was back in June of the full faculty and staff. I'm not sure if I surveyed them today, what the results would tell me. I'm not sure that all faculty are checking their emails and may not do so until the 23rd. If the committee wishes me to do so, I'm happy to share that survey or create a survey to push out to the faculty and staff. And again, we'll get what we'll get. I don't know that I can force them to answer, but hopefully they would, in an effort to give us the best data possible to make the best decision for the schools.
Andrea.
Yeah, yes, and I would also like, I mean, while we're throwing ideas out there, first of all, those are small numbers. So congratulations to our staff. Like, that's huge. I think they are taking safety first. But
that number is based on the respondents. So
right. Yeah. Still, it's a sampling. So I think it's. I do think we should have a survey because we'll get some information, and I think the committee should consider different ways to encourage people to get vaccinated. So there's all kinds of ideas out there that we should investigate to be early adopters of things.
Like incentives.
Okay, so did we make a decision on that? Are we doing a survey first?
I think that makes sense to get a better understanding where we
figure
are.
out first how many people are vaccinated before we put anything.
I would suggest too doing a survey of, do you want to be vaccinated? Like, that could be just a question, right? And then, but I would do this all in tandem. We're about to ask our kids to come back to school. And I think if we're going to mandate vaccination, we should be fair to the staff and the students and get this moving as quickly as possible, have an end date for people to get vaccinated by, and otherwise this will move down. It'll be December by the time we get going.
If I may, I know we're talking, Andrea, I join you, like, our staff has done phenomenally. If we're looking at a total of 7, a handful of faculty in both schools that have not been vaccinated, and that's just from our, from the surveys today, then that's phenomenal on the school's part, and they deserve all the credit for that. But if it's one faculty member in our school system that's not vaccinated, then that's in my eyes, we're asking our kids to go back in masks. We're not being forced to do that. We are making this decision as a committee to bring our kids back in masks. If we have one faculty member that is not vaccinated, I have a problem with that, and I would like to see that the school committee makes it mandatory for faculty to be vaccinated.
And again, Kurt, you can make that motion right now. If I got a second, we'll take a vote.
Right, I know, but is it more appropriate to do that let the policy committee do that, or do we just do it now?
You could, I mean, it wasn't on an agenda, so it's new business, but you could do it now and then tell them to write a policy for it, right? So it's horse and cart, you pick.
All right, so I will make a motion that we require faculty and staff.
I'd like to speak if you don't mind. I don't mean to cut you off. I'd rather tell you the truth. I'd rather see the information first that we would have from the first survey. I'd rather see that we have the information first so we can make the appropriate direction. That's just my opinion. I'd rather see the information.
I think either way, even if you get the information that everybody's vaccinated, if the expectation is you want everybody vaccinated, you're still going to have a policy because you're going to have new employees at some point. So if the expectation is that everybody has to be vaccinated, you're going to have a policy that everybody has to be vaccinated because people are going to come in and go out. Does that make sense? So either way, even if everybody's vaccinated now, if the expectation is that everybody is vaccinated, you're going to still have to have something that, am I making sense? Because there's employee turnover. So either way. I'm just saying, the chair of the policy committee is going on vacation tomorrow, and she's going to be gone for a week to see her boy, who she hasn't seen in a year. So there will be no policy committee with the chair. So if you're doing a policy in the next 48 hours, it's not with me. Just saying,
Yeah, Monday would be appropriate, or Tuesday, right?
not with me.
Not with you?
Well, with that said, I don't think we can do that without you. I mean, I have to be honest. My mind is blown a little bit by Kirk here, but not in a negative way. I just wasn't expecting it. So I'm taking a minute to digest it and think about it. But I don't think that we can have a policy meeting to go over this and look at any data, Andrea, without you. There's 3 of us. If you're not there, there's only 2 of us. I don't know how comfortable I feel about that. So if the choices are waiting versus now, I mean,
Let's wait then. Let's wait.
or let's do it.
Let's put it to the policy committee. Yeah, I want to see this happen, but let's put it to the policy committee first. Let's look at what other, like Berkshire Hills, they obviously have a policy about it because they just instituted it. So maybe we can get it from them, or we can get it from somebody else. Let's put something together first, and then we'll vote on it.
Yeah.
And I'm not even saying we have to. Kirk, I don't want you to think I'm saying we have to wait, because
No.
I'm with you. I'm with you. I'm just taking a minute right now, but I do understand and agree with what you're saying. It's pretty.
Yeah. No,
it's pretty bold, like Andrea said. But I mean, I like bold. I appreciate it, and the point is very valid. And I feel very strongly, like I said, about our students going back in masks and keeping everyone safe. I didn't even have to think for a second about what my choice was in that. And I have 2 little kids, and thinking about the flip side of it, like your points, Kirk, you have some good points there about the staff as well, helping to keep us all safe. So it's, I mean, a very good point to bring up right now.
I say we take this to the policy committee, let them put something together, and then come back to the full committee.
Well said, well said.
Okay.
Adjournment?
So can he please make that motion?
Yes. Kirk, make the motion that the policy committee will
Create a vaccination policy.
Okay, so I would like to make a motion that the policy subcommittee makes a policy regarding faculty vaccination for the COVID-19 pandemic.
A recommended policy.
A recommended policy, yes.
And can we not refer to it as faculty? Can we say faculty and staff? Because it's 2 different things.
Yeah.
That's perfect. That sounds great.
Need a second.
Second.
Any discussion?
I think Mike was waving to us.
Yes, Mike.
Yeah, I am a little bit. I don't want to get into your business, but I'm wondering if instead of faculty and staff, if we say employees, isn't that the idea? Custodians, cafeteria workers, clerical staff, everybody comes across, our students and our visitors. So perhaps we just capture it by employees.
Yeah.
And I will also tell you, there's already an email in their inbox asking them to take a 1-question survey on their vaccination status.
Okay, so we need to amend the motion to say that there be a policy for all employees of Lee Public Schools to be vaccinated with the COVID-19 vaccination.
Right, so I'll amend my motion to send, or to ask the policy subcommittee to recommend a policy for all employees of the Lee Public School System to be vaccinated. If that's correct.
Against? Do we need to say what vaccination?
Oh, COVID-19, the COVID-19 pandemic. Thank you.
Second.
Any discussion? Brenda, can you do a roll call, please?
Mr. Robin,
Yes.
Mr. Kinnis,
Yes.
Mrs. Kosharik,
Yes.
Ms. Larman,
Yes.
Mr. Nichols,
Yes.
and Mrs. Wadsworth.
Yes.
the subcommittee will get together when Andrea gets back from Canada.
Sounds good to me.
All right. Anything else you'd like to task us with before we adjourn?
No, I'm going back to vacation. Thank you.
I'll make a motion, we adjourn.
Would
I'll
anybody-
second it.
Thank you. Any discussion? All right, Brenda. Last roll call.
Mr. Robin,
Yes.
Mr. Kenneth,
Yes.
Mrs. Kashirk,
Yes.
Ms. Larman,
Yes.
Mr. Nichols,
Yes.
Mrs. Wadsworth.
Yes.
All right, we are adjourned at 6:36. I'll see y'all in a week and a bit.
Have a good night.
Yeah.
Thanks,
Bye.
Lois.
Have a good night, everybody.
Andrea, enjoy.